and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Final year mbbs student at Safdarjung Hospital hangs self in hostel room. In a shocking incident, a final year mbbs student at the Safdarjung Hospital allegedly hanged herself in a hostel room. The police post at the hospital received information about the incident at 3:30 a.m. on Thursday. The student, a resident of Delhi, was residing at the mbbs girls hostel Safdarjung Hospital. She was found in a room in the mbbs hostel of the hospital. Police reached the spot and found the Vardhaman Mahavir Medical College and Safdarjung Hospital student hanging by her neck with a scarf in a room in the hostel. 1 year service in rural tribal areas now mandatory for PG Medicos in Andhra Pradesh. A 1 year service in rural and tribal areas is to be made compulsory for postgraduate medical students who complete their course with government support. The government has taken a policy decision in this regard and necessary orders will be issued soon, said Andhra Pradesh Principal Secretary of Health MT Krishna Babu. He also told media that about 400 students pursue PG medical education with the government support in the state every year under Category A. Initially, we wanted to make it compulsory for all postgraduates, but now we have decided to restrict it to Category A students only. This will ensure availability of adequate number of specialist doctors in rural and tribal areas. National Medical Commission reverses its stand on tech norms for the non-medical teachers, says old rules will be followed. Filing an affidavit before the Delhi High Court, the NMC has reversed its stand on the reduction of permissible percentage of non-medical teachers with medical MSc PhD qualifications. The Apex Medical Commission filed the affidavit in response to a writ petition filed by the National MSc Medical Teacher Association and other associations and individuals on the guidelines published in the Minimum Requirements for Annual MBBS Admissions Regulations 2020. Referring to the earlier order issued by the Union Health Ministry in this regard, the Under Secretary of NMC has mentioned in its affidavit dated 30th August 2022 that it is respectfully submitted that insofar as challenge to the minimum requirement for annual MBBS admissions regulations 2020 or the teachers' eligibility qualifications in medical institutions regulations 2022 as raised in the present writ petition is concerned, the answering respondent, after due consultation with the central government in various meetings, has decided to abide by the decision of the central government as communicated via order dated 3 January 2022. Jenburkt Pharma launches FDC Nervijen D3. Known for its popular brand Nervijen, Mumbai-based Jenburkt Pharmaceuticals Limited has recently launched a fixed-dose combination of methylcobalamin vitamin 3 under the brand name Nervijen D3 tablets in India. This FDC aims to address the issue of vitamin D3 and B12 deficiencies concurrently seen in neuropathy patients due to nutritional deficiency. Approved by the DCGI, the FDC of Nervijen D3 may help manage symptoms of lower back pain, cervical spondylitis, cachexia, radiculopathy, prolapsed intervertebral disc, diabetic peripheral neuropathy, prediabetes, metabolic syndrome, cardiovascular disease, vitamin B12 and vitamin B3 deficiency. Indian cervical cancer vaccine to hit the market very soon. India's first indigenously developed quadrivalent human papillomavirus vaccine for the prevention of cervical cancer will be launched in the next few months and will also be affordable to all, said Minister of State for Science and Technology Jitendra Singh. He also said that COVID-19 had raised awareness about preventive health care and the development of vaccines, like the one against cervical cancer, was a result of the efforts made by scientists for over a decade. It will be made part of the national vaccination program in a few months, implying that all R&D activities pertaining to the vaccine are complete. It has been developed by the Pune-based Serum Institute of India and the Department of Biotechnology. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.